Awesome. So I think we can get started. Everyone, welcome back from break. We're really excited to have Dr. Sheri Brownstein to present on dentistry as a career pathway. So a little introduction about Dr. Sheri Brownstein. She is a professor and dean at the Midwestern University College of Dental Medicine on the Arizona campus. She completed her Bachelor of Science in Biology from University of South Florida and a Doctor of Medicine in Dentistry from University of Florida. She is a member in many nationally recognized dental associations, such as American Dental Association, Sigma C, Scientific Research Association, American and International Associations of Dental Research, to name a few. And her research interests span from dental materials, dental education, and preventative dentistry. So with that said, please welcome Dr. Brownstein.
Hey, good morning, everyone. Thank you, or actually afternoon here. Thank you for being here. I am going to go ahead and share my screen. Let's see. Oh. Start my presentation. Can you see my screen?
Yes, we can see it.
Thanks so much. All right. Well, thank you, Ting and Alexia, for the introduction. Again, I'm here in sunny Arizona in Glendale. So just outside of Phoenix, just northwest of Phoenix. I've been here at Midwestern University for 15 years, and I just finished my second year here as dean. So I've worn a lot of different hats here. Today, I'm going to talk about dentistry as a career. I'm going to kind of go through application process, and then kind of what dental school looks like in a very broad overview. I'll try and get through everything in about 30 minutes. Kind of a disclaimer, I'm giving you my own personal knowledge of what I've learned here at Midwestern. Dental schools differ. There's almost 70 dental schools in the country, but most of us are pretty similar. But just know if you're researching dental schools that each one might have a little bit of a different process. So at Midwestern University is, like I said, it's located in Glendale, Arizona. We have our sister campuses located in Downers Grove. The Downers Grove campus opened in 1900 with their osteopathic medical school. The Arizona campus was founded in 1995 with the osteopathic medical school. And since then, we've grown considerably. We're a healthcare institution. We offer doctorate and master levels programs, which is nice because we can interact with a lot of different healthcare professionals. But again, today I'm going to focus on my area, which is dentistry. So I'm going to kind of talk about, why dentistry, different career paths that you can take. You don't necessarily have to be a dentist. Applying to dental school, some things you might want to look for in dental schools, and then kind of an overview of the dental school curriculum. This is an overview of our campus. It's beautiful here today. It's about, I think it's going to get in the hundreds, so it's getting a little bit warm. But we're blessed to be located in a really nice area in Glendale, Arizona, kind of situated in a very residential area. So a lot of people are thinking about dentistry or different healthcare careers, and I can tell you that dentistry has been voted consistently in the top 30 to 50 careers in U.S. News and World Reports, and then we hit the 3 of the top 10 healthcare career jobs in 2023. And the reason is that, dentistry is a very rewarding career. You can use a lot of different skills, and then the work-life balance in dentistry is wonderful. You can work as much or as little as you want. You're not on call in a hospital. You're, for the most part, not necessarily dealing with a life or death situation. You can really improve the quality of someone's life. Dentistry combines a lot of different disciplines. There's a lot of art in dentistry and in helping the form and function of your patients. You're using your sciences because we're not just treating the mouth, we're treating whole people, and there's a large component of the oral systemic connection where we really need to know about people's overall health. We are dealing with people and human beings, so there's a lot of human behavior and communication. And then there's a lot of really cool technology that's coming out now. We use 3D imaging, 3D printing, CAD/CAM technology, We're using AI now a lot in education and also in dentistry. We have AI software that can read x-rays. You're also collaborating with different professionals. And like I said before, you're really restoring the form and function to your patients, which can make a huge impact on their health and on their happiness. A lot of people have some dental anxiety, and talking to someone and getting them over their anxiety and creating a healthy smile, so maybe something they've been embarrassed of their whole life, can really make a huge impact on their lives. You also have a skill that you can take anywhere in the world and help those with no access to care. This is one of our international service trips. We went to Tonga. This was in 2017, I think, is when we went. We had to stop our trips when the pandemic hit, and then we are resuming in the fall of next year. But this was a young man. He was 16 years old at the time we saw him. And when he was about 10 years old, he was playing rugby and got hit in the face and broke his 2 front teeth. And he's been like this for 6 or 7 years, and was really, really self-conscious about his smile. He didn't like to smile. He didn't really want to show us his teeth. So, I mean, this isn't a life-threatening injury, but it's something that's really impacted his life for years. But in 30 minutes, 2 of our third-year students restored his teeth. And he was so grateful and so happy, and just was smiling ear to ear for the rest of the time he was in the chair. So that's a really, really rewarding thing that you can do for your patients with, very, very small time. And you don't need to travel to be able to serve. You can do pro bono work at your own clinic. You can serve at a free clinic in your area, and you can give away treatment if you like. So that's another great aspect of dentistry. So like I said, you don't necessarily have to be a dentist. You can be a general dentist, which is like a family dentist. Probably about 10 to 15% of our students will specialize. So they'll become a specialist, and I'll go over the different specialty areas. You can become a dental hygienist, which dental hygienists they clean the teeth, they do nutritional counseling for patients. They also can give local anesthetic and help the dentist. Dental assistants, also, they're not necessarily just chair side. They can also design and create restorations using CAD/CAM software. Dental hygienists and dental assistants can also take extra coursework and be able to place dental restorations. So the dentist can drill the tooth, and then the hygienist or assistant can come in. They're called expanded function. They can come in and do restorations. A dental office manager manages the finances, but also manages the human resources aspect of the office. Laboratory technicians use a lot of technology to create prostheses and dental restorations. And then you could do like I did and become a dental educator. I practiced for 10 years. So I've done both things. I've practiced dentistry, and now I'm in academia. There's a lot of different practice settings that you can go into. You can go into a private practice, which is just 1 or 2 docs in a building, and you have your practice. You can go into a large group or corporate practice. You can go into academia and teach for a living. You can go into dental research. So all the materials and techniques that we use now had to come from somewhere. And so there's some very bright people that started as dentists and now work in dental research. And then you can go into public health or the federal service, the military. I can tell you with academia, public health, and federal service employment, there's a lot of loan repayment opportunities if you go into those different areas. And then the different disciplines and specialties. Specialties, you can be an oral surgeon, which they do a lot of facial surgeries and tooth extractions. An endodontist does root canals. Orthodontist straightens teeth and also helps with the bite and how the teeth fit together. A periodontist focuses on the supporting structures of the teeth, so making sure your gums and your bones surrounding the teeth are healthy. Prosthodontists do a lot of advanced restorative treatments on patients, sometimes even restoring parts of the face that may have had to be removed due to trauma or maybe cancer. A pediatric dentist focuses on children and adults with special healthcare needs. An oral radiologist works with diagnostics, both 2D and 3D imaging. A dental anesthesiologist will typically go into a dental office and put patients to sleep, and then for the practitioner to work on. Oral medicine focuses on oral systemic connection and diseases. And then there's only 81 in the world, but there are forensic odontologists that help to identify remains of the deceased. So there's a lot of different disciplines. As a general dentist, you can do any of these specialty areas as long as you can do it at the level of a specialist. So I was a general dentist, and it was great because I could work on kids, I could do root canals, I could do extractions, I could do whatever I wanted. My husband's a specialist; he's a pediatric dentist, and he's also a dental anesthesiologist. So his work is very focused. So it just depends on, once you get into the school, if there's something that you really want to focus on, you can then go on to specialize afterwards. And then if you're thinking about applying to dental schools, like I said, there's about 70 plus dental schools in the United States right now. And you're probably not going to be able to apply to all of them or visit all of them and go for interviews. So there's a lot of different things that I looked at when I was looking at dental school. The location, I think, shouldn't be a big factor unless you need to be in a certain area and be close to family. Dental schools are either 3 to 4 years long. So we really live anywhere for 3 to 4 years. You should just be happy and make sure that the fit of the dental school that you're going to is going to be good for you. Class size might be important. Some of the classes are 60 students per class up to almost 300 students per class. So if you like a small intimate group or if you like being in a big group, that might be something that's important to you. I think more importantly is the faculty to student ratio. And these are all questions that you can look up or ask once you get an interview. Are you going to be in a simulation clinic with 100 students and only 2 faculty, or are you going to have a 5-to-1 faculty to student to faculty ratio? It's very important to make sure that you're getting the support that you need. And then what kind of student support services does the university and the college offer? Is there tutoring? Is there counseling? Is there someone that can help you to support you during your educational experience? What does the preclinical experience look like? What are your first 2 years? Are you going to be able to go to the clinic and see patients, or do you have to wait till your 3rd year? Are you going to get a lot of hands-on? Is it more didactic? What is the clinical experience? That's very, very important to make sure that the clinic that you're working in, the dental clinic, is able to provide the patients and enough patients so that you can get the clinical experience, because you want to be able to graduate competent and confident and be able to be practice ready when you graduate. You don't want to have to do a 1-year postdoc residency if you really just want to get to work after dental school. How's the clinic set up? Are you able to find chairs in the clinic? Do you have to provide your own patients, or does the dental school provide patients to you? If you want to do research, is the research program robust? Some students want to, some students don't. Might be important to you. If you like doing community service and outreach, what are the service opportunities that you can have? And then also, very important, dental school is expensive. All healthcare schools are expensive. Is the return on the investment going to be worth it? Can you find employment afterwards? What are some support services to help you find a job after you graduate and be successful? And then when you decide to apply to dental school, you have to finish your prerequisites. Some dental schools require you to have a bachelor's degree. Some dental schools do not, and you just have to make sure that you have all your prerequisites. They might be a little bit different from school to school. The DAT, or the dental aptitude test, is kind of like the SAT or the ACT when you're getting into college. It's very focused on science and reading comprehension, things like that. You'll have to take that. You have to get your transcripts. You'll write a personal statement, and you'll need letters of recommendation. Some schools do have a supplemental application, but again, you really need to research each individual school. My advice to you is apply as early as you can. You apply through a centralized application service portal, and make sure you have everything in that you need. Most schools, I know my school, we have centralized admissions department, and then we have our dental school admissions department. And if a student does not have, say they're missing their transcripts or they're missing their DAT score, that application will never get to my desk. It'll just stay in the centralized admissions department. So apply early, be proactive. call the admissions department if you've applied and you haven't heard anything and you feel like you have before. That's what they're there for. They're there to help and guide you. Because you don't want to get in a situation where it's, applications open up in May and then it's September and you haven't heard back from the school. I can tell you we have about 6,000 students applying for 140-ish spots each year. And the earlier you can get your application in, the earlier you can get your interview. Decision day is typically December 15th, is when we're allowed to invite our first round of students. And then we continue to, and most schools will continue to have applications through March, or application day, admission days. And then what we are looking for, obviously we want to see your science and your overall GPA. So we need to know your stats and your DAT scores. But there's a lot of students applying, or applicants applying, that have similar scores. That's not necessarily the most important thing. What we want to know is that you can handle the rigor of the program and that you're going to be successful. We would never want to admit someone and then have to have them drop out because they weren't prepared. So the numbers and the scores are pretty much, that's what we're looking for. We just want to make sure that you're going to be able to get through the program. Really important, we look at voluntary service. So what kind of service have you done? What's your work experience? Have you worked with the public before? Are you going to be a compassionate provider for your patients? What things extra have you done? What extracurriculars have you done in college? Were you in a fraternity or sorority? Were you in a club? What kind of leadership positions did you hold? Course load, again, speaks to whether or not we feel like you're going to be successful in our program. We have some students that have taken very heavy loads and we know that they can be successful. We have other students that maybe worked full-time, had to have a job, had a family, and took a little longer to get through their undergrad and maybe had to take a lighter load. Nothing wrong with that, but that's something that you'd want to let us know in your personal statement. Also, if you had a lot of withdrawals, a lot of W's on your transcript, things like that. Again, it's not a deal breaker, but that's something to kind of explain in your personal statement so that we know, look, I had an illness or something happened externally, so I had withdrawals from some classes. But then if we see a trend up where you're taking heavier loads and you're successful, then that's fine. Things happen, and we completely understand that. We want to see what do you know about dentistry? Have you shadowed? Have you worked in a dental office? We have a lot of our students that were hygienists or were dental assistants, were dental lab technicians. They tend to be very strong students because they have some experience in dentistry. And then, of course, we'll look at your letters of recommendation, and your personal statement is, like I said before, is very important because there's a lot of students that come in that have very similar GPAs. And we want to see what sets you apart. Why are you going to be a good fit for our program? Make sure your personal statement is professional. It's not a creative writing assignment. Make sure that it's very positive in nature. So we want someone that's going to be optimistic and positive. And just to kind of give you a reference, this is the class that's going to graduate next year. These are our kind of our averages for the class. So there's students that were higher, there's students that were lower that got in. The undergraduate overall science GPA was a 3.53, and then the total GPA 3.68. And then the rest of the scores are the DAT, the dental admissions test. So that the AA's academic average, reading comprehension, perceptual ability or quantitative reasoning, biology, organic chemistry, and then the total DAT score. So each section is out of 30 points, so 1 out of 30. I think the national average is about 18 or 19, and these are our average scores for the class that matriculated that year. And then you've decided on your school, you sent in your application, and you got an interview. Congratulations. So the interview day, our interview day is probably about 8 till 2:30. So it's a full day because we really like to showcase our program. Definitely research the school, go to their website, know what they're about. so that, it looks like you're actually interested in going to their school. So each experience will be a little bit different. Make sure you arrive early. The traffic in Phoenix here can be a bear in the morning. And I'm sure other cities are the same. So give yourself a lot of time to get there. Dress professionally. Think about, the words you're using, how you're interacting with everyone. Know that the minute you step foot on campus for your interviews to the moment you step off, there's someone watching you. So it's not just that 30-minute section for interview. It's when you're touring the clinic. It's when you're touring the pre-clinic. It's when you're having lunch with the students. All those things, if there's an unprofessional interaction or something that happens, it will get back to the admissions committee. So just keep in mind that whole day, is kind of an interview of sorts. If you have access to it, do mock interviews. Have someone interview you. Have questions ready for the admissions committee when they typically at the end will say, do you have any questions about the program? I usually give a little 30-minute presentation the first beginning of the morning to all of our applicants. And I always ask them if they have questions afterwards. And you really know that the students have researched the school when they have specific questions about the program. I'm sure you guys are all on Reddit and Student Doctor Network and Dental Nachos and all those portals. The more you can find out about the format of the interview, it's going to make you more prepared as well. The more prepared you are, the more relaxed you'll be. And I remember my dental school interview. I was super, super nervous. But as much as you can, relax and just be yourself. And also know that you're interviewing us as well. We might think you're a great fit for our program, and you'd be like, I don't like Arizona, or, I don't like how they do this or that. So the day really is for you as well to see if you want to spend 4 years here and get your education here. So no, it kind of goes both ways. And then congratulations, you got into dental school. There's two different kind of types of dental schools. There's more traditional programs, and then there's our program is a little bit I call non-traditional, just the way our clinic is structured and the way our academics are structured. We don't have any departments here, so everything's kind of together. Our curriculum is integrated. So in the first year, your basic sciences and your oral health sciences, there's not separate courses in biochem and physiology and histology. You're taught in systems. So you're taught in the cardiac system, the renal system, hepatic system, and then each of those systems is accompanied by a patient case. So your patient might have a kidney transplant, but they also have dental needs. And so you have to kind of think again about the whole person and how you're going to be treating that person. Oral health science is the same thing. We don't have separate courses in root canals and crowns and fillings. We work comprehensively on the mouth and incorporate everything kind of together. It's most dentists and dental students are very type A, so sometimes it's kind of hard to kind of not separate and silo each thing, but it really works, especially when you get into the clinic and you're treating patients as a whole person, not just as, this tooth or that tooth or this procedure or that procedure. We teach as just as important are our community service, our personal finance, our multicultural healthcare, human behavior. So those soft sciences, because you are going to be treating people, you're going to be interacting with people from different backgrounds and different cultures. So you really need to know how to interact with people. You also need to know how to manage your finances, because you have to be financially successful to sustain your family and be able to put food on the table and things like that. I know a lot of people don't like to talk about money, but you have to make a living. So we want to make sure that you're successful in that way as well. You have your preclinical lab, which is that top left slide. That's our sim clinic here. And every school has a simulation clinic that's probably very similar. It's where you do everything from cleanings to root canals to fillings to crowns on your mannequin before you see human patients. And then there's clinic rotations. Most schools have clinic rotations starting in the first or second year, where you go to the clinic and treat each other, do cleanings on each other, head and neck exams, things like that. And then you also treat some patients in the clinic. There's research opportunities. Research at our institution is not required. But we do have a very robust research program and student research group. So our students are very active in research. Faculty mentoring, you want to have, we assign all of our students we call them Succeed coaches, but faculty mentors, and many other dental schools do as well. But it's kind of nice to have a go-to person when you get to dental school that you can ask questions, get extra help, things like that. And then peer-to-peer learning is very important for you guys to learn from each other, swap projects, evaluate each other. It's always nice to watch how someone does something because they might be doing it a little bit differently than you. So that's really all 4 years. And then in the 3rd and 4th year is typically when students will go across the street or to a different building or wherever their clinic is, and start treating patients almost full time. Our students are in the clinic 4.5 days a week, and they have classes 1/2 day a week in the 3rd and 4th year. Some clinics have different departments. So if you want to do a crown, you go to the prosthodontic department. If you want to do a filling, you go to the operative clinic. Cleanings, go to the periodontal clinic. And that's how my school was at University of Florida. Works very well. Our clinic doesn't have any departments, so our students have their own operatory. The first floor is all of our specialty clinics. So if our students' patients need to see a specialist, they can go downstairs to those clinics with their patient and be seen by the specialist. Otherwise, they're in their operatory. We partner our 3rd and 4th year students. A lot of schools are doing that now. It's very efficient where you have an assistant. You're watching and you're doing the procedure the same time. So it's even more valuable learning for the students. And they do anything from cleanings to placing implants to using our lasers, the printers, dentures. Every aspect of dentistry is done in their operatory. Like I said, unless it's something that needs to go to specialty, if it's a difficult extraction or if it's a difficult root canal, they'll go down to specialty clinic and get help with our specialists. Most schools have some sort of external rotation that they do. Our students do at least 3 weeks in a community health center. We have 4 different external service rotation sites that the students spend time in. They see different population of patients, and it's almost like going into their office because you don't have to get, they don't have to get as many start checks and things like that, where it kind of slows things down in a dental school because they are students and they need some oversight. And then again, the research is available all 4 years. So I think I did pretty good on time. I'm going to get to my last slide. Thank you again for everybody for being here. I know that was a lot of information. I kind of went from beginning to end, but if you want to follow us, that's our dental school Instagram. Also, our Midwestern Instagram is Midwestern Uni at Midwestern UNI. This is our website, and then my email if anyone has any questions either about our school or just about dentistry in general, or getting into dental school. I'm happy to talk to you. So, thank you.
Amazing. Thank you so much, Dr. Brownstein, for the really comprehensive presentation. I think it's really nice to see from like the beginning and kind of towards the end to see that whole process. So to start off, we have a question on if you wanted to become like an oral surgeon, do you need to attend both dental and medical school?
So that's a very good question. There are 2 different paths you can go for an oral surgeon. Typically, you go to dental school first, so you'll do your 4 years of dental school. And then there's 2 different types of residency programs. There's an MD, DMD, so you get your MD degree as well. And then there's the oral surgeon. So the MD, DMD program is 6 years after dental school. So you do 2 years of medical school, then 4 years of oral surgery. And then the non-MD is 4 years after dental school. And it just depends on what you want to do. Some of our MD, DMDs end up doing plastics and things like that, whereas the DMD oral surgeons typically will do more exodontia like extractions and not simple surgeries. So they're still doing pretty complex surgeries, but it just depends on what your focus wants to be.
Thank you. And kind of zooming out, we had a question about like, since there's so many different pre-health professions, to kind of hear a little bit about the personal motivations you had to pursue dentistry out of all the other career options that are available out there.
Sure. So first disclaimer, my dad's a general dentist. So I worked in his office and shadowed him since I was, just a little kid. I used to clean his toilets in his office and play in his lab. But actually I didn't start out wanting to do dentistry. I started out as a psychology major. Um, and then got further into my sciences and really enjoyed it. And I'd always liked doing little art projects and things, working with my hands. So it was probably my sophomore year of college when I decided to pursue a degree in dentistry. I like the aspect. I like the human aspect. I love talking to people. My assistant used to always tell me to be quiet because I had more patients waiting for me. And just the joy and the reward that you get from treating patients. I miss treating patients. I haven't practiced dentistry full time in about 15 years, and I do miss it. So it was kind of a give or take going into academia. I love what I do, and I wouldn't trade it for the world. But treating patients is a real joy.
That's so nice to hear. As also a fellow psych major, it's so nice to hear like the diverse. And also I came in not wanting or haven't decided on my career until I explored in college. So I definitely relate, and I think a lot of our audience can relate to that.
Yeah.
So then, kind of talking, we hear about dentistry and private practice and a little bit about like kind of managing kind of a more business aspect, managing clinics. So one of our audience members asked, do you find that the business administrative side of dentistry to be an advantage or a disadvantage for the profession?
Well, there's a lot of different aspects you can go into. If you want to focus on the business aspect, you can be a practice owner. I never did. My husband had four pediatric practices, and I helped him with those, and I didn't want. So when I was practicing, I was an associate. So I just kind of came to work. I treated my patients. I didn't have to worry about human resources or the financial aspect. But it depends on what you want to do. It's Dentistry can be very lucrative. I think it's as long as I think that what it comes down to is if you treat your patients well and you treat your staff well, you'll do well. It's kind of like that golden rule kind of thing. But I was not interested in having to deal with all that, which is kind of funny because as a dean of a dental school, that's kind of a big part of my job. But yeah, it just depends on your interest and what you like. It's a lot more work. I can tell you my husband spends a lot of time. He has a wonderful office manager. So if you surround yourself with good people, then it can be easier. But it does create another level of work and stress having to manage your own practice.
Mm.
But it's not difficult. It's just more.
Right, right. No, thank you for providing that insight. And I think out of state also is you showed a lot of like different dental specialties, and I know you decided to become a general dentist. So did you explore the other specialties as well, or what was that motivation that really decided general dentistry is the way to go?
I didn't want to limit myself to just one thing. There wasn't one thing that I was really passionate about. And like I said, I saw my dad as a general dentist and he did a little bit of everything. And there, like I said, there wasn't one thing. I thought very briefly about oral pathology because I thought it was very interesting, but I wanted to practice dentistry and I didn't think I could do both.
Hmm. Thank you. And kind of like focusing in on more of like a pre-dental, since a lot of our audience is in that phase. So for studying with the DAT, is there kind of like a golden standard available, like Q&A banks? I know for personally for like medical school, it would be like the UWorld is a highly recommended resource. Is there any resources you recommend that would help you prepare for the DAT?
Well, when I took the DAT, I had a big box of index cards with with all the questions on them. But I can tell you, I don't really know much about any of them, but I do know that my students tell me that dental boot camp and dental decks are two ones that are pretty popular. And it was actually the dental decks it was actually a deck of index cards with all the information on it. So I think it's probably digital now.
Another format,
Yeah.
another format, same thing. That's amazing. And as someone reviewing kind of the dental school applications, what would you say would be the top qualities that stand out to you from as someone that you would like to accept into the dental school?
Um, Someone that has experience with people, someone that's going to be teachable, someone that's going to be a team player. Our students are not competitive with each other. They help each other out. They're not cutthroat. I think we have right now 5 rising D4s that are applying for oral, that I know they're applying for oral surgery. They all stay together, they work together. So just being a nice, compassionate, caring person is really important. And someone, like I said, that's going to be teachable. It's going to, kind of follow the rules and then again, they need to be able to get through the academic rigor. So I'd rather take someone with an overall GPA of 3.2 that's just a kind individual that's going to work well with others than a 4.0 that's going to be cutthroat and trying to get into ortho or whatever it might be and not be good to his or her peers.
That's so amazing to hear. I think like to hear that it's really a holistic process,
Mhm.
the qualities. I think definitely there sometimes can be a stress on like perfect stats and not
Yes.
having enough time to allocate yourself to
Yeah.
explore in the experiences.
Yeah. We have a lot of non-traditional students that it's a second career, or they've done something for a while, or they've taken some time off or been in the military. And those are very, very good students typically.
So highly recommend gap years for people to take. And then I heard from your presentation that transitioned from practicing like over 15 years ago to now being academia. What made you decide to transition from practicing now to being a dental educator?
So it was actually kind of by accident. I was in private practice here in Phoenix, and my husband had his pediatric practices and decided to go in and do a second residency in dental anesthesia. So we moved, us and the 3 kids, we moved to Los Angeles, and he went to UCLA. And while I was there, I was like, oh, just, maybe I'll try to teach part-time. So I taught 3 days a week at UCLA Dental School. I taught 1 day in the clinic, 1 day in the pre-clinic, and then 1 day at their Venice, one of their external rotation sites, and just absolutely fell in love with it. We moved back here after he finished his residency, and I was like, oh, there's a dental school 5 miles from my house. Midwestern had just opened in 2008, and this was 2010. So I applied and I started working part-time, part-time here and part-time still practicing. And then after a year, I said, this is what I want to do. I asked the dean then at the time if they ever had an opening, and they did. And here I am. I never,
That's
I thought that I would just teach for, 10, 15, 20 years. And I never had designs on administration or becoming a dean, but it's just kind of, what happened.
That's so nice to hear, like hearing that course path and just that everything kind of fell right in place.
It did.
And so what would you say has been the most challenging part, and also the most rewarding part of being a dentist?
Um, the most challenging part is probably educating patients on what I feel is best for them, and sometimes case acceptance. So and you'll learn a lot of that when you're in dental school, and then you'll learn a lot more when you get out in practice, because a lot of people don't prioritize oral health. So just getting the patients to understand how their oral health truly does affect their systemic health and the different connections, and just getting rid of disease. I never was really into like selling big aesthetic cases or doing things like that, but it was always kind of disheartening when you could fix something, but the patient either couldn't or wouldn't accept it. So I think that was probably one of the hardest things. And again, the most rewarding is just changing someone's outlook, either changing so that they're now comfortable going to the dentist, or they're free of pain, or they're like the young man in Tonga, they've had some sort of something that they were made them uncomfortable and self-conscious, and you can fix that for them. That's the most rewarding thing.
Mm, Yeah, no, that's so nice to hear both aspects of that. And we like to ask this to all our speakers to kind of get a gauge, and just to hear about like the insight, the personal stories you share. So out of like curiosity, do you know what the history of dental medicine and why it may be separate from per se like pursuing allopathic medicine and going to medical school? Like why is there two different tracks?
That's a really good question. And it's something that's kind of come up. Dentistry, and this is my own knowledge base. Don't, you can fact check me if you want, I might be wrong. But I believe dentistry was more of an apprenticeship than a medical field when it first started, hundreds of years ago. And it's now kind of morphed more into whole body health. And so it was, I think the dentist was the barber. You go to the barber and you get your hair cut and they pull your tooth. And now we understand that there's a lot more to it, that the oral microbiome is a major factor in health. And I think that's why a lot of the newer dental schools adopted a DMD instead of a DDS, doctor of dental surgery, versus a doctor of medical dentistry or medical dental degree, because it is more of a medical degree. You can teach anyone to, drill on a tooth in a certain way, but you have to understand why and how that's affecting the body. So I think that's kind of the shift from, hundreds of years ago. It was, like I said, it was just like a blacksmith or a barber or whatever. And then now it's more of a medical doctor position.
Oh, that's so interesting to hear that because I'm not too familiar with the history. So I always wondered, because both have really impactful experiences and a service to patients. So
Mhm.
just wondering that divergence. And yeah, and I would say we have one last question would be, what would you say is like a number one like misconception about like oral health or protecting your oral health? And like just to kind of leave us off on good note also is like what tips you provide as a dentist that you would like people to do more of? Because we also have younger audience and preventative dentistry.
I think one of the big myths that I heard a lot when I was practicing is regarding primary teeth or baby teeth. Like, who cares? They're just going to fall out. And it's so misleading, because if um, tooth pain is the number one cause of missed school in school age children. And if a child's in pain, they can't focus. A lot of times they can't eat, so it affects their nutrition. So I think, focusing on primary tooth health and children's oral health is extremely important. And some people just think that, oh, well, they're going to fall out. They get a second chance. They get a second set of teeth. And so it doesn't matter. I think that's a big misconception I've seen. And then tips, I think, just take care of your teeth, take care of your nutrition, because it does have a huge impact on your overall health. There's so much research and science coming out now, like I said, about the oral microbiome and how it affects the gut microbiome and how everything's just connected. And how everything kind of affects everything else. So, just taking care, getting regular checkups, and if something doesn't feel right, going and getting it taken care of.
That's so nice. With that, I think that concludes our questions that we have. And thank you so much for presenting, Dr. Brownstein,
Well, thank you for having
on
me.
the whole comprehensive pathway. It was just really nice. And hearing also your personal insight about being a holistic process and getting involved and really showing that compassionate side. So up next, we have a session about medical school from University of Virginia. So feel free to start making your way there. But thank you again, Dr. Brownstein, for coming and sharing your time on a Saturday with us.
Thank you. Thank you, Tank. Thank you, Alexia. It's very